Welcome to the deep dive. Today, we're going to explore something that's both fascinating and kind of scary. The effects of pressure to the neck.
hmm
You sent us a video lecture on this, and
Uh,
wow, it gets pretty intense.
yeah.
We're talking anatomy, potential consequences, the whole 9 yards.
Yeah, it's amazing how much we're still learning about all this.
Yeah.
For instance, trying to figure out the exact cause of death in those cases involving neck compression.
hmm
It's still a bit of a mystery in some cases.
Really?
Yeah,
Okay, so let's unpack this. Let's start with the basics.
yeah,
The lecture really emphasizes how vulnerable the neck is.
yeah,
It's like a superhighway, like all this vital stuff is running through there, blood vessels, nerves, you name it.
right.
And there's even a link to an interactive 3D model in the source material. Have you seen that?
I have. It's really cool. It's a fantastic way to really visualize just how much is packed into such a small space. Makes you realize why even, seemingly minor pressure can have significant consequences.
Oh, absolutely. Like one of the things that jumped out at me was this discussion of petechial hemorrhages, petechiae. I'd heard the term, but I never really understood what they meant until now.
Yeah, those are basically tiny red or purple spots that can appear on the skin or mucous membranes. Think of them as little warning signs that something's interfering with blood flow. And what's wild is they can form in just seconds if the veins in the head are blocked.
Really? Wow. The lecture actually mentions that playing wind instruments can cause them.
That's right.
Who knew? But on a more serious note, it also stresses that petechio by themselves don't automatically mean that someone's experienced neck compression. There are a bunch of other potential causes too.
Exactly. And it can be really tricky for forensic pathologists to tell the difference between them and hypostasis postmortem, which is basically the settling of blood due to gravity after death. It's a bit of a, detective work there.
So if petechia aren't a slam dunk, what other signs should we be on the lookout for if we suspect neck compression?
Well, think about the anatomy. If the neck is being squeezed, you might see facial congestion, maybe even like a bluish tint to the face.
Okay.
Sometimes air can get trapped under the skin, something called subcutaneous emphysema. Bleeding from the nose or ears without a direct injury to the area is another red flag. Things like that.
And of course, there are the more obvious signs like trouble speaking, or pain in the neck, or hoarseness. It makes sense when you consider that, the larynx is right there in the thick of things.
Exactly. Each symptom is directly tied to the underlying anatomy and physiology.
Okay, so now for the big question. How does pressure to the neck actually lead to death?
Yeah.
The lecture outlines three main theories.
Right.
Um,
So the first one, which is probably the most intuitive, is cerebral hypoxia.
okay.
Basically, if the arteries supplying blood to the brain are blocked, the brain is starved of oxygen.
Okay.
And we all know how vital oxygen is.
Right. And without oxygen, brain cells start to die pretty quickly,
Yeah.
leading to unconsciousness. And if the blockage isn't relieved, eventually death.
Exactly. The second theory focuses on airway obstruction. Think about what happens when someone chokes on food. The same principle applies here. Pressure on the neck can push the tongue back, blocking the airway. No air in, no air out.
Right.
Simple as that.
And then there's this third theory, which is all about this little spot in the neck called the carotid sinus.
Right.
And it's located right where the common carotid artery branches off.
Mm-hmm.
The lecture has a really helpful diagram showing this.
It does, yeah.
Yeah.
The carotid sinus is super sensitive because it houses these things called baroreceptors, which are like little sensors that help regulate blood pressure.
So what happens if those nothers get, well, a little too much stimulation?
Well, that's when things can get really dangerous. The baroreceptor reflex kicks in, trying to stabilize the blood pressure. But in these cases of neck compression, this reflex can go haywire, causing the heart rate to either plummet, that's bradycardia, or skyrocket tachycardia, or even leading to a systole, which is a complete cessation of the heartbeat. Or ventricular fibrillation, which is basically chaos in the heart rhythm. Any of those can be fatal.
Wow, so that one tiny spot in the neck can trigger a whole cascade of potentially deadly heart problems.
Exactly. It's really interesting, isn't it? It really shows how finely tuned our bodies are and how easily that balance can be disrupted.
And then the lecture goes on to talk about how the lack of oxygen or hypoxia, further complicates things. It cites all sorts of research, animal studies, cell studies, even theoretical models, all point to the same conclusion, that hypoxia is really bad news for the heart.
Yeah, it can set off a chain reaction of, increasingly dangerous heart rhythm changes, ultimately leading to cardiac arrest.
So we've got the physical side of things, the blocked arteries, the airway obstruction, the carotid sinus stimulation. But we can't forget about the psychological impact, right?
Right.
Imagine being in a situation where someone's got their hands around your neck. The fear, the panic, the pain.
Absolutely. That fight or flight response kicks in, flooding your body with adrenaline.
Mm.
And while that might help you escape danger in some situations, it also puts a tremendous strain on your heart.
And you combine that stress response with all the other physiological effects we've talked about, and it's a recipe for disaster.
It is, yeah.
Yeah.
It can even lead to something called stress cardiomyopathy, where the heart muscle basically weakens because of the emotional stress. It can mimic a heart attack.
Wow.
Yeah.
Now, here's where things get even more interesting. The lecture also briefly mentions something called the conservation response, which is kind of the opposite of fight or flight. Instead of your body going into overdrive, it kind of shuts down.
Yeah, and that can have cardiovascular consequences too, potentially leading to fainting or other problems.
This is all getting pretty complex. It seems like there's a lot we still need to learn about the interplay between the physical and psychological effects of neck compression.
There is. And things get even more complicated when we start talking about restraint scenarios, where there might be pressure on the chest or the abdomen in addition to the neck. That's where we'll pick up after a quick break. So before the break, we were talking about how these restraint scenarios add another layer of complexity to understanding the effects of pressure to the neck.
Yeah, it's like trying to solve a puzzle where some of the pieces are missing.
Exactly. And the lecture really stresses the importance of a thorough medical exam for anyone who might have experienced neck compression. Whether it's in a restraint situation or any other context, it's about connecting the dots.
So what are those dots we should be looking for? We talked about petechiae, those tiny red or purple spots, but the lecture also emphasizes the importance of asking the right questions.
Right. It's not just about what you see. It's about what you hear, too. A detailed history is crucial. Asking about any incidents involving neck compression, no matter how seemingly minor.
Because what might seem insignificant at first could actually have some serious consequences down the line.
Exactly. The lecture even mentions the possibility of delayed complications, where someone seems fine initially, but then develops problems later on.
That's kind of scary. It makes you realize how important it is to monitor anyone who's experienced neck compression, even if they seem okay at first.
Absolutely. Early intervention can make all the difference. And this is where awareness comes in. Not just for healthcare professionals, but for everyone. The more we understand about the potential dangers of neck compression, the better equipped we are to prevent and manage these situations.
Knowledge is power, for sure. Okay, so we've talked about the medical side of things, but the lecture also delves into the legal and forensic implications of neck compression.
Right.
This gets especially tricky when restraint is involved.
It does. The source material actually talks about the challenges forensic pathologists face when trying to determine the exact cause of death, especially when multiple factors are at play.
Like trying to untangle a giant knot. As the lecture puts it, you've got hypoxia, acidosis, hyperkalemia. It's a lot to sort through.
Right. And let's break those terms down for a second.
Okay.
Hypoxia means the body's tissues aren't getting enough oxygen.
Right.
Acidosis is a buildup of acid in the blood.
Okay.
And hyperkalemia means there's too much potassium, all of which can disrupt the heart's rhythm.
Okay.
Yeah.
Yeah.
So when you have all these things happening at the same time, it must be almost impossible to pinpoint what role neck compression played in the death.
It can be incredibly challenging. The science isn't always clear-cut.
Right.
And this ambiguity can have major implications for legal proceedings.
Right, because ultimately someone has to be held accountable. But if the cause of death is uncertain, it becomes a lot harder to determine who's responsible.
Exactly. And this is where ethical considerations come into play.
How much force is considered reasonable? When does restraint cross the line into excessive force? These are tough questions, and there are no easy answers.
Yeah, no easy answers. It's fascinating how this deep dive takes us from the intricacies of anatomy and physiology all the way to these complex legal and ethical dilemmas.
It really shows how interconnected all these issues are. Something as seemingly straightforward as pressure to the neck can have far-reaching consequences.
It's a reminder that even seemingly simple actions can have profound effects, and that understanding the science behind those effects is crucial for making informed decisions, whether we're talking about medical care or legal proceedings.
It also highlights the importance of ongoing research in this field. The more we learn about the mechanisms of injury and death in cases involving neck compression, the better we can equip ourselves to prevent these tragedies from occurring in the first place.
So let's pause for a moment and recap some of the key takeaways from this deep dive so far.
Okay. We started by talking about the vulnerability of the neck and the various signs and symptoms of neck compression.
Right.
Everything from petechiae and facial congestion to difficulty speaking and hoarseness.
Mm-hmm.
We then explored the three main theories of death: cerebral hypoxia, airway obstruction, and carotid sinus stimulation,
Mm.
each with its own set of complexities.
Yeah.
We also discussed the psychological factors at play, how fear, anxiety, and pain can amplify the physical effects of neck compression, and how the body can respond in different ways, either with that fight or flight response or the conservation response.
Right.
And we touched on the challenges faced by forensic experts in determining the precise cause of death in cases involving multiple factors, highlighting the importance of a thorough medical exam and a detailed history.
Right. Right.
We also ventured into the legal and ethical considerations surrounding restraint and the use of force, recognizing that assigning blame in restraint-related deaths is often a complex and contentious issue.
It's been a pretty intense but incredibly informative journey so far. But before we wrap things up, we want to leave you with one final thought, something to ponder as we move into the last part of our deep dive.
Okay, we're back, ready to wrap up our deep dive into the effects of pressure to the neck. It's been quite a journey, hasn't it? We've gone from the anatomy of the neck all the way to the courtroom.
Yeah, it really highlights how a seemingly simple action, like applying pressure to the neck, can have such profound and far-reaching consequences.
One thing that really struck me is just how much we still don't know. There's all this ongoing research and debate about the exact mechanisms of death,
Right.
particularly when it comes to carotid sinus stimulation and, the role of psychological stress.
Yeah, there's still so much to uncover. That's what makes this field so fascinating. Every new study kind of brings us closer to a more complete understanding, and that knowledge is crucial for developing, better strategies for prevention and intervention.
Absolutely. So if we were to distill this whole deep dive into one key takeaway, what would it be? That's a good question. For me, it would be this. Never underestimate the power of pressure to the neck. Even what might seem like a relatively minor incident can have a significant impact.
Right.
We need to be aware of the risks, both for ourselves and for others.
And that awareness goes beyond just recognizing the physical signs, right?
Right.
It's about understanding that psychological component too.
Mhm.
How fear and stress can amplify those physical effects.
Absolutely. It's about having a holistic view of the situation, considering all those factors at play.
Yeah, and it's about advocating for more research, better training for healthcare professionals,
Right.
and greater public awareness. I mean, this isn't just a medical issue, it's a societal issue.
I couldn't agree more. The more we know, the better equipped we are to prevent these tragedies from happening in the first place.
So we've squeezed every last drop of insight from this deep dive.
I think so.
But as always, we want to leave you with something to chew on, something to ponder as you go about your day.
Okay, how about this? If pressure to the neck can have such dramatic and potentially deadly effects, even in relatively short durations, what implications does that have for activities where sustained pressure is applied, either intentionally or unintentionally?
Ooh, that is a good one. Think about certain martial arts techniques or even some therapeutic practices that involve applying pressure to the neck.
Exactly. It raises all sorts of questions about safety protocols, informed consent, and the potential risks involved. It's a reminder that we need to approach any activity that involves pressure to the neck with caution, knowledge, and a deep respect for the power we hold in our hands.
Well said. On that note, we'll bring this deep dive to a close. Thanks for joining us on this exploration. It's been fascinating and, at times, I'll admit, a little unnerving.
Yeah,
But ultimately, I think a very important conversation.
I agree. Knowledge is power, and hopefully this deep dive has empowered you to be more informed, more aware, and more prepared to navigate the complexities of this often overlooked but critically important topic.
And remember, stay curious. There's always more to learn, and we'll be here to guide you through the depths of knowledge. See you next time on the Deep Dive.